Good afternoon, everyone. Very excited that you can attend this symposium or this mini seminar um, of the Biobanking series, seminar series of the Philippine Genome Center. So today, we are very delighted to have a special speaker from the WHO, from the International Agency for Research on Cancer. Very excited that he was able to entertain. I'm sure he has a very busy schedule, but he told us that he's very interested in establishing a biobank in the Philippines or partnering with the biobanking activities here in the Philippines. In fact, he's already doing some initial conversations with people from RITM, and I hope some of the people here, some of the RITM are with us today. Let me go and introduce the speaker today, Dr. Zisis Kozlakidis, I hope I pronounced it correctly, is the head of the Laboratory Services and Biobanking at the International Agency for Research on Cancer, World Health Organization. So I'm sure most of you, if not all, are familiar with WHO. And Dr. Kozlakidis is responsible for one of the largest and most varied international collection of clinical samples in the world. I mean, we're very familiar with what WHO is doing, so this is very exciting for us that we can potentially partner with WHO through Dr. Kozlakidis. And he has a very significant expertise in the field of biobanking and has served as president of ISBER. And for those who are familiar with biobanking, you're very familiar with ISBER as well. And he's also a board member of ISBER. Dr. Kozlakidis is a virologist with a PhD in microbiology from Imperial College London. He is an elected fellow of the Linnean Society of London, the Royal Academy of Sciences, UK, and a Turnberg Fellow of the UK Academy of Medical Sciences. He serves EOSC as co-chair of the task force on upskilling countries, and he also served as editor-in-chief for the peer-reviewed international scientific journal, Innovations in Digital Health Diagnostics and Biomarkers. He has contributed to studies in the adoption of innovations into routine healthcare and their associated financial impacts. He is scientific advisor to the P10 Research Foundation and the National Health Research Infrastructure of the Netherlands, and holds an MBA, imagine that, from the Business School, City University of London. He is co-founder of the City Healthcare Innovation Network, a conduit for providing and strengthening contacts between healthcare startups and financial institutions based in the financial district of London. So we can learn so much from him when it comes to sustainability, when it comes to biobanking. And he holds visiting faculty positions in China, Belgium, and UK. And maybe, who knows, maybe Philippines as well. So with not much ado, let us welcome Dr. Zisis Kozlakidis.
Thank you very much. Really, very happy to be here, and thank you very much for the invitation and the PGC for hosting the meeting. So I'm going to share my presentation, and hopefully you can all see it in presentation mode. Before we start, I just wanted to say I will share my slides with the PGC, and if anybody is interested, please feel free to contact them and get a copy of the slides. Also, please feel free to put your questions on the chat, and we'll answer them towards the end. So today's talk is going to concentrate on the international trends and standards in biobanking. But before we launch into the trends and standards, I'll say a few words about the agency where I'm based, about the World Health Organization, And towards the end, we'll bring it all together as to what this means for the regulatory landscape, in particular in Southeast Asia. But first things first. So the Agency for Research on Cancer is a department of the World Health Organization, if you like. It was created in 1965 with the expressed mission of studying cancer. And to this day, we perform research, and our research has four particular elements. It has to be interdisciplinary. It has to be inclusive of low and middle income countries. It's not just for the discovery, but it's intended to inform public health decisions, to inform governments for their policies, but also professionals for developing guidelines and standards. So for a lot of the research that we do, you will see even later that we present some of the examples, there is a direct link with the guidelines and standards. So what do we do? What does this mean from day to day? We produce the classification of tumors. So if you are a pathologist or work in pathology at all, you know this is a global reference for the classification of tumors. At the moment, we are in the 5th edition. So every 5 to 7 years, the books are updated. So right now we're in the 5th edition. It's the first time that this edition is available online. And it's the first time that this edition is accompanied by genomic data as determinants of the classification of tumors. We expect that the next edition will integrate even more genomic data. So our direction of travel has moved from the pathology to include genomic as a very, very serious complement to the decision tree of the classification of tumors. Another part of our day-to-day work is the classification of substances. For example, here you see nitrite and the cyanobacterial peptide toxins. But every year, the monographs group based at IARC will classify substances to the level of carcinogenicity for humans. And you can see we have a simple scale, group 1 to 3, or no indication. And the latest, most, let's say, popular or publicized event in terms of this announcement was the classification of aspartame that was announced last year. This year, we continue with PFAS and PFOS, and we just finished, or the monographs group just finished, the list for the classifications that will take place over the next 3 and 4 years. So there is a regular series of elements that are being investigated. At the same time, we look at the technical side. So we don't just look at what other people do, we look at what we do and how we can translate our SOPs to be useful globally. And the books, our technical publications, vary widely. So we have the common minimum technical standards for biobanks dedicated to cancer research. We have protocols for thyroid health monitoring that was updated after the nuclear accidents in recent years. We have the colposcopy and treatment of cervical precancer and so on and so forth. The latest IARC handbook was on oral cancer. So you can see we go from the policy to the very technical and back. What does our group do specifically? Well, our task is to maintain the high-class laboratory services and biobanking facility, not just for IARC, but for the World Health Organization and for the member states. To generate the data from interdisciplinary research, so we do our own research, and then we synthesize this information for the production of guidelines, and of course, develop partnerships to build local capacity. We cannot do everything ourselves. Actually, it would be silly to think that we can do. We have to work collaboratively with local partners, developing capacity and taking the lead for most of this work. Before I move on to talk about biobanks, I just want to give you our definition. There are a number of definitions for biobanks. What we consider for the last 2 decades as a biobank is infrastructure that has biological samples, associated data and information, increasingly genomic information, and also a governance framework. If you just have samples with some data, for us, it's not a biobank. It's just a collection of samples. You have to have the legal and ethical framework as to who access the samples, under what conditions, how they distribute. And you can see here that for the biobank at IARC, we have just over 6 million samples. We've used about a third of these samples. The projects are about 400 over the last 10 years. And each year we service about 25 to 30 projects. And the number of providing countries are 87. It doesn't mean that we haven't received samples from other countries, we've used them. At the moment, we have samples from 87 countries. And you can see on the map just the geographical distribution. We're based in Europe, so practically it's easy to have a lot more samples from Europe, but we have from the rest of the world as well. So what does our research look like? We do research on the biomedical research infrastructures themselves. For example, how do you set up an infrastructure? What does it mean that you have an infrastructure? What are the elements that you need to pay attention to? For example, safety, sustainability, operational resilience. Then we do research towards guidelines. So how can we produce guidelines that relate to the quality of the biobanking activities, the quality that then leads to accreditation of your biobank, and then research that relates to biological functions. So our group looks a lot onto the digital health and also the microbiome currently. I'm more than happy to answer any questions you might have about research. I know that I only give a few examples, but please keep in mind it's only a few examples. There's a lot more that we can discuss. So that is the IARC background. That's where we're coming from. So what are the current trends in biobanking? What we can definitely see is that the biobanking user demands have expanded. So it's not simply about collecting the samples and storing the samples. Biobanks have to take part in the patient management. They have to provide input in the consent form and how consent is collected. They have to collaborate with the pathology as to how the samples are collected and transferred to the biobank. And then be able to handle the increasing amounts of data. The increasing amounts of data. For example, how do you collect the data? How do you clean the data? Upload it onto virtual catalogs so that others can look what you have, and then facilitate the transfer of samples and data, or just samples or just data. If we look at the most recent WHO report on cancer that was published in 2020, you can see the very schematic progress from prevention to the end of life care. And they are highlighted areas where the interaction with biobanking infrastructure really takes place very strongly. One is in the beginning when you do the screening. So this is when we decide to create population cohorts and then follow them over time as they develop disease. At the diagnosis, so this would be disease-specific biobanks that would concentrate, for example, on specific cancer types. And then you would have follow-up or survivorship. So, for example, we would have rare diseases where people have been cured and there is a re-emergence, or we would have population cohorts where they've been treated with a particular pharmaceutical agent, and then we'd like to see whether there is any level of toxicity, any impact downstream in terms of the efficacy of the medication. So as an infrastructure, it serves many users and it services many purposes. If we are to summarize the development of biobanking as a field over the last 20 years, we can see that we moved from the focus of the number of specimens, the number of diseases, the size of the biobank. So that was in the beginning, when biobanking was feeding the Human Genome Project, and we were worried that we cannot collect enough samples, as many as are required for the Human Genome Project. But we were able to do this, and biobanks were able to scale the operations. Very quickly, that question moved in terms of the quality of the samples and the cost of operations. So are we sustainable? Are we reproducible? And now there is increased attention on the value of the collected samples and the impact of biobanking. And really the added value comes from the data that we collect and are relevant to the samples. The impact of biobanking often is associated with the discovery within populations of particular characteristics. So we can see there is talk about the impact and the added value. As a market, if we look at the whole field, we expect a very consistent growth. So what is driving this growth? In one word, well, maybe a couple of words, the Human Genome Projects across the world. So we have a number of Human Genome Projects. In Southeast Asia, we have the Indonesian Genome Project. Malaysia is having a National Genome Project initiative. Also, in the Middle East, we have Saudi Arabia, Qatar, the United Arab Emirates. They all have national genome projects. So this is a very basic driver for maintaining the biobank growth globally. But also, what we see is that still the largest collection is happening in North America and Europe. So the area where we anticipate most of the growth to happen in the next 10 years is Southeast Asia. You can see that it is underrepresented in terms of the samples that are being collected and used for research. We collect samples, but it's important to say that what we can do with these samples now is a lot more than we could do 20 years ago. And this is where the question of the added value comes in. Because from a single sample, we cannot just facilitate sequencing. We can really look at a number of analytic factors, and we can use that information for a number of downstream applications. What it means for the biobank itself is that we need to integrate very seriously with computing, with bioinformatics, with genomic services, on top of the infrastructure, the physical infrastructure for holding the biological sample. But really, data is what will underpin the new trend in biobanking and research. If you look at the year-on-year increase in data use in the fields of activity for the economies, the major economies, so this data comes from the G20, healthcare is the largest single producer of healthcare has experienced the single largest increase year on year for annual growth in terms of the data it produces. So healthcare will continue to produce more and more data, and that really would reflect in the biobank operations. Do we have any example? Yes, we have examples from the UK Biobank. So this is one of the largest and one of the earliest biobanks. It's not necessarily a good example for everywhere globally. I think it's a very good example how to set up a biobank in high income settings. In other contexts, there will be other solutions that are better suited. But what we can glimpse from the UK Biobank is that increasingly, together with the physical samples, we have an increased demand on the data. And interestingly, in the last couple of years, there were demands only for data. Of course, because of COVID, we couldn't transfer samples. So this is a bit skewed, but it shows you the trend that as a biobank, we need to be prepared to share the samples, but also just data. So these are the major trends in biobanking internationally. Let's see at some of the examples of biobank infrastructures. So what do other countries do in response to the trends that we just described? And I'm giving you 3 or 4 examples. There are a lot more, and I'm happy to talk about different contexts. This is just to facilitate the discussion and to give an idea of what's happening globally. The Japanese infrastructure is creating. Oh, let's see. Can you see my? Well, I hope you can see. So there is a central biobank database. So what happens is we have individual biobanks that are disease oriented. So there is cancer biobanks, national cancer biobank, national cardiovascular disease biobank, national neuropsychiatric biobank, etc. They do not share the samples. So the samples are in each individual facility, but the databases are linked. Not fully, but they're linked in terms of being able to search the basic parameters. And as a researcher, you can access by disease or you can access by population. And within the population, you can structure different disease types. So that's the idea behind it. And there is a biobank management committee, and so far it seems to work. So you can, this setup gives you the possibility of creating your own cohorts, of investigating specific disease cohorts as well. In the UK, it's a different approach. So you have the biobank as part of the DNA repository. It moves into the sequencing centers, and then it's the sequence that is being able to share it. But you cannot access the sequence directly together with the clinical information. This is they create a mirror image interface, and clinicians, academics, and industry can access that mirror image interface with different levels of permission. So there is one circle that is for the health ecosystem of the UK, and there is a mirror image of a subset that is available for researchers in the industry. The Netherlands and Belgium do something very similar. So in the Netherlands, they've allowed the data that is collected for biobanking to be harmonized as much as possible. I want to say standardized, but it's not fully standardized, but it's very well harmonized. But what it means is that they can have local instances installed in each biobank. When there is a query of national importance, that query is going to the local instance. The local instance interrogates the database of the biobank, and then the user knows how many samples of a particular disease are available across the national network of biobanks. And it's very interesting, especially for rare diseases or rare conditions, that you can do this because suddenly you can create cohorts where before it wasn't possible. Belgium has a very similar approach, but they decided to do it on a disease orientation. So the cancer biobanks have come together, they created a network, and all cancer-related requests for samples and data in Belgium have to go through this network. In response, the Belgian government has provided increased funding to ensure that all these or most of these biobanks become accredited to guarantee the quality of the samples. So if you say that you can only use one provider, you make sure that the quality is of the highest standard. Then we have our own research at IARC. So this is what's happening in different parts of the world, but it's only fair that I present some of the research that we do as well using the biobank sample. A large part of our work is to identify mutational signatures of different cancers that relate with different types of exposures. So here you can see the signatures that we get for aristolochic acid. Why is this important? It's important because it comes from a very defined exposure. This is the plant Aristolochia, and it's used in traditional medicine. So we know, depending on the signature that we get, the mutational signature that we get in the cancer, whether this has been induced by this particular exposure. So you can see in Europe, the answer is no. In North America, is very rarely. But in China, Southeast Asia, it can be very high in locations. It's not to say that this plant is always bad. It's just the type of preparation of this plant that is causing the cancer, becomes a driver for cancer. And that is a very long list of mutagraphs or mutational signatures of cancer. So far, we've investigated the genomes of over 5,000 very well-defined cancer patients from all 5 continents. And that work is going to continue and double or even triple in size over the next few years. So we start understanding cancer as a link, direct link to the exposure via the mutational signature. We can use that information in the reverse. We can screen now populations and find those that have the genomic signature as being very, very exposed to the carcinogenic effect, and then start producing guidelines or advice. One of the most recent studies that we've published in my group has to do with the stratification and the model creation, in particular for colorectal cancer, using this approach. So we've sequenced a lot of the microbiome, and we start doing this correlational study between the microbiome profiles and colorectal cancer across different populations. This is work in progress, and we hope that when we start having enough data, we'll move from correlation to causation and a deeper understanding of the preventive window for colorectal cancer. A slightly different publication from my group as well. So here we just used genome-wide association studies together with polygenic risk scores for nasopharyngeal carcinoma to try and identify those at the highest risk and where we can apply EBV test within a population in a way that makes clinical sense. There is no point to test everybody because you can see those with the lowest risk at the bottom 20% or even average risk, so at least half. It would be a waste of a test. We need to be very well focused so that we can get maximum clinical benefit at a reasonable cost. How do we facilitate a lot of this work? We have a biobank and population cohort network. So this is infrastructure where we provide training and the harmonization of processes according to international standards, and also provide open access, uh, free open access to the educational material that is linked with biobank. The network is a network of biobanks and infrastructures that support research, and it is free to join. We anticipate those that participate will interact to the activities, but there isn't any cost. It's just whether we have a harmonized enough base that we can start a collaboration. For example, when COVID came, we we very quickly activated the network and said, well, what is your experience of COVID in terms of biobanking? What has remained the same? What has changed? And then we published a special issue that was part of the Biopreservation and Biobanking Journal, because it was a very good picture globally. The NIH provided a grant through the Center for Global Health to make all of these articles open access. At the moment, we work together with BioAster, which is a French non-profit molecular biology and microbiology technology institution, to support the Trinity Challenge. The Trinity Challenge is uh, the opportunity to sequence samples, bacterial samples from low middle income countries, so we can get a representative um, picture of antimicrobial resistant data. We already have a good picture in the high income settings in Europe. We want to see how this compares with what's happening at the moment in low middle income countries. And this is a line of activity that we pursue at the moment. Again, if you're interested on any of these examples, please feel free to ask questions or contact me later. So I spoke that we do work on the data on the digital side, and this is an example of this work. So moving away from the lab, but still in research, we started to identify the knowledge and gaps and priorities. So this is work together with the BCNet, with the network, to understand what are the main gaps in biobanking, in research that's supported by biobanking. And 2 years ago, as part of the Lancet Oncology Commission, we started providing a little bit more granularity. So it's not enough to say, oh, biobanking is not working here or it's difficult here because we don't have good standards. What does it mean? It means that we need harmonized documentation forms. We need the large treatment centers to set the example and coordinate between them, because once you set these examples, they become the informal standards and you can come later and formalize. So you can see that we start providing a bit more granularity. We continue the work post-pandemic for low middle income countries. And the network that we have identified 5 priority aspects. And you can see the table. Please don't try to read everything at the moment. I've provided all of the references, and if there is any issue in identifying the reference or being able to download, again, feel free to contact me. I'll provide the reference. So we know the types of infrastructures that we have and the types of challenges. Then we started doing the work on what types of samples we have and what is the relative concentration of the samples. For example, blood-derived products, DNA, RNA samples, and FFPE. Why is this important? Because when we have a national genomic initiative, for example, already we can tell governments that most of your biobanks would collect uh, samples that can convert into DNA. And we estimate that at least a quarter of the material that's collected is in the form of DNA extraction. So you can see we start getting a bit of granularity. The big question for us is about the type of data that is held in biobanks, and more importantly, even the quality of the data that is held in biobanks. And we have a number of ongoing activities research activities to start answering this question. Good. So we've spoken about the IARC perspective, about the trends in biobanking globally, and how these trends connect with the activity that we do in terms of research. Now, our mission is to bring it back all together in regulation and guidelines. So the last part of the discussion of this presentation is going to be about the regulatory landscape. We know that digital health and all the data in healthcare are important, but the first time that that was firmly placed on the table, on the agenda for the G20 was in 2020, when, as part of the G20 presidency, Saudi Arabia organized the Riyadh Global Digital Health Summit, and there was the Riyadh Declaration with a number of very high-level recommendations in terms of digital health. 2 years ago, as part of the Indonesian G20 task force, we started breaking down these very high-level recommendations into more practical ones. So what does it mean when we talk about digital health? It means that we need to have transparency and trust in terms of the data that is being accessed, who is accessing it, for what reason. We need to have the technology that is available within the public health systems to be able to facilitate this and to be able to support this trust. And we need to have equity in the digital health capability across regions, if not globally. So you can see we start breaking it down. And we also published a policy brief in terms of how do we build back better? How do we incorporate the lessons learned from COVID into our activities in biobanking? The last couple of years, together with the ASEAN Health Secretariat, we've been looking at the biobanking specifically in the ASEAN region. What we can see is that the activities fall into one of three broad categories. We have structurally integrated biobanking systems that are very mature, and these are Singapore, China, and Japan. Korea, to a lesser extent, it's very mature system as an individual biobank. It's not as well integrated. Then we have a lot of customized activities. So this is the majority of the biobanking that's happening in Southeast Asia. They're very project-driven, very event-driven. And while they may be individually excellent, we cannot accumulate the added value because we cannot provide the integration. And there are some rare examples where we have the collaborative sharing of data, but that is not the norm. It's under very specific conditions. So if we look at the regional needs, we can say that there are centers of excellence and dedicated networks, that are available equipment that have LIMS, laboratory information management systems that can support training and stuff, but this needs to be translated into capacity improvement opportunities. So these centers of excellence need to be supported in some way, not only to understand the regulatory landscape, but to use what they have to provide these opportunities, the training, the quality assessment, and the risk communication. So the ASEAN leadership has reached a high-level agreement for the biobanking of samples, and that means that well, it can be summarized in 5 points. It means they're very supportive of regional collaboration. They're very supportive of training and capacity building. They can see that gaps exist. If we have the support for regional collaboration, the training, then we can start to see that the information sharing may come through. Once we have information sharing, we have the foundations for innovation, and then we can talk about innovation, coordination, and support. And importantly, none of this has to happen independently. It has to be complementary to existing structures. So from the ASEAN Secretariat perspective, the complementarity is a big point. Also, what we have found with our research, the protection of the intellectual interest, the intellectual rights for all the samples and data is a big concern. There is a very fragmented landscape when it comes to the protection of intellectual rights, and that holds biobanking back because the individual biobanks do not necessarily know where the lines lie in terms of sharing samples and data. Maybe nationally it's clear, but if you move regionally and internationally, it's not as clear as that. So what we have done is we mapped the development of the regulatory landscape in ASEAN biobanks over the last 2 decades. So you can see what it was in the year 2000, so 24 years ago, if you can cast your mind. And one is, well, 0 is that there isn't really very much biobanking activity. 1 is that there is localized biobanking activity. 2, that it's moving into centers of excellence with some integration. And 3 is full integration, if you like, on the x-axis. And we can see over the years that the countries in Southeast Asia have really moved in the right direction, but at varying speeds. That means that the landscape will remain fragmented for the foreseeable future because everybody develops at a slightly different rate. We will all reach the destination, but in different ways, and we have to be cognizant from now and develop these conditions for sharing data and samples. So what do we expect in the future? Well, we expect an increased focus on ethics and IP. Ethics, why? Because the technology advancement has increased our ability to generate and disseminate large amounts of information. And sequencing data is the largest by far, but it will come with imaging data, it will come with population level data in terms of lifestyle, biometrics, nutrition, even educational level, etc. So we need to consider the risks associated with these new ways of carrying out research. The easiest level of risk is the direct harm and the disclosure of sensitive personal information. But really, because we can do so much more now, the higher level of risk is the misrepresentation of population groups. Southeast Asia is highly diverse with very many different population groups, and we have to be as inclusive as possible. And also to do it because of trust and transparency. Biobanks cannot survive unless there is trust and transparency. And there is always the question about the new data-driven technologies, specifically artificial intelligence, where AI can be fully explainable all of the time. I mean, the answer is no. There are parts of AI you can explain and parts you cannot explain, but how can you apply this onto biobanks that now will start holding standardized large volumes of data? So we do expect increased focus on ethics. We anticipate also increased complexity. We can collect samples from different population cohorts, and they can come for satisfying the primary research question. But then secondary research questions will emerge that will need the reorganization of these collected cohorts into different combinations. So that complexity has already been experienced by early biobanks like the UK Biobank, IARC Biobank, and we think that this is going to continue in the years to come. From our side, we continue to turn the research output into an educational resource, and you can see here two examples. 3 years ago, at the beginning of the pandemic, we launched the Global Laboratory Leadership Program, and that is going very strongly. Together with the WHO Academy, this year we will complete the course Managing Healthcare Research Infrastructures, and it will be officially launched in May of 2025 as part of the World Health Assembly. Also, we don't do things as an island. So you can see this progression in biobanking. In 2017, we published the Common Minimum Technical Standards. Then we collaborated with ISBE to publish the 4th edition of Best Practices in 2018. Both of these documents were used to create the ISO standard in biobanking. So you can see we moved from the Common Minimum Standards into the guidebook how to improve with the best practices into the high-level standardization. And the qualification of biorepository science was launched by ISBER in 2020. In 2021, Alexandria University created the first course in biobanking dedicated for low middle income countries. So you can see there is a continued improvement. Of course, this year ISBE published the 5th edition of best practice incorporating the lessons learned from the pandemic. So in conclusion, because I wanted to leave a few minutes for the discussion, we can see that there is a demand for high quality samples, and that demand will continue globally with increasing numbers of samples required for high throughput analysis. And that supports the creation of biobanks. A big chunk of these will be dedicated to national genome projects. The biobanking landscape in ASEAN specifically is highly fragmented, and it consists of islands of excellence. So we're not starting from zero. In fact, there are very many facilities that do fantastic work. The question is, how do we normalize or harmonize the regulatory landscape to support the integration of this work into larger programs? And we can say that the maturity of the regulatory landscape has increased over the last 2 decades, but there is further room for optimization and development. And the key consideration for biobanks is the protection of intellectual right. Finally, there is very positive support by the ASEAN Health Secretariat, and I have to thank personally Ian Medina from the IARC-ITM for his excellent collaboration over the years, especially for the ASEAN Health Secretariat work. We finally feel that the voice is being heard and that there will be a regional level understanding for the sharing of data and samples under specific conditions. I would like to thank you very much for your attention. And these are my details. And yes, please feel free to contact me or link in any way possible. I'll stop sharing and then we can move on to the questions. Thank you very much.
A very exciting talk. I learned so much, and it's amazing that I can see how much you know about in this area in Southeast Asia. There's some things that I also didn't know. I was like, oh wow, I was looking where the Philippines is over there as well on your graph. So we can entertain questions now from the audience. If you you can, I guess you can do a lot of different ways. You can type in your answers in the Q&A. And if you don't know how to do that, you can also put it in the chat box, I guess. And then if not, maybe they can unmute also, and then they can ask questions, so whatever you prefer. There's also a raise hand button somewhere if you are if you're not so sure what to when to unmute. So while we're waiting for questions, maybe I can ask mine. um, I can see that in Southeast Asia how fragmented biobanks are. And in fact, in the Philippines, I can already see that most of our biobanks are project driven. That's really how it is so far. We're hoping that we can move towards a unified system, or at least a harmonized one, as you mentioned. But I don't know when that will happen. So in terms of the guidelines for, let's say, access to samples in the IARC biobank, let's say in cancer, and if let's say in the Philippines, do you envision something where Philippines can be part of that IARC biobank and how to be such? And of course, one thing that I see why it's very difficult in terms of fragmented biobanking is they probably looking at the benefits. How will it benefit the country, or how will it benefit the biobank itself? I mean, or the source biobank. So, yeah, maybe can you have...
Yes. So a lot of the examples we use from IARC, we use countries like Belgium and Netherlands to say, oh, we've done this or that. And I'm very well aware that that's a smaller population. You know, Netherlands is maybe 3 times less than Mindanao, or you know, the smaller populations that you can do this integration much easier. I think for the Philippines, we need to be working on exemplar projects that will be locally driven, and that will give the opportunity for others to understand how this work can evolve, and sort of be able to see where it goes in 3 years and 5 years, and then join later on. The way we've done it in the past is to start creating networks. So I'll give you an example. In Malaysia, we supported the creation of the national network of biobanks. Not a lot. In the beginning, only 6 or 7. And even now, it's not a lot. It's about 11. And we understand why. It can never be a lot because you depend on pathologists in hospitals, and it's so rare to find a pathologist anyway. And then a pathologist on top who is interested in biobanking is even rarer. But the moment you can go to the policymakers and say, look, the 5 of us can sit on a table and together we can agree on some basic information. Can you provide some support that we can advance in a more national effort? I think that's an argument that generally is very well received. And I can tell you our experiences from Malaysia have been replicated in Egypt, they have been replicated in Indonesia, in Poland. So it works. The speed, it is slow. Anything that has to do with support from policymakers is slow, but it's there, and eventually it has a positive impact on the sustainability of the biobanking efforts.
Oh, excellent. Actually, we have a law, no, on cancer registry, and there's a Philippine Cancer Center that's established, and they're still a very baby stage, and we're hoping that maybe they can expedite the creating a unified system for cancer at least. So I can see that in the Philippines, maybe it might be driven based on diseases. No, that's what
Yes.
you
Yes.
showed in Japan. So maybe that's how it will start here in the Philippines.
Yeah, and there isn't a single solution. So every country has a unique context, a unique set of populations. I mean, Philippines is an archipelagic nation. You know, you have all the different islands and population groups. So that's a very specific context, and that solution has to come from within the Philippines first.
Excellent. Guess I don't see any questions yet. How about in terms of sustainability? I know a lot of biobanks are struggling with this, and
Yeah.
sometimes we ask these questions as well. Although it's more project based, so project funds it. But what do you see in terms of sustainability? And maybe you have opinions in Southeast Asia where you saw some how biobanks are operating here. You have
Yes, so when we talk about sustainability, I always have in mind that excellent publication by Daniel Simeon Dubach and Marianne Henderson, where sustainability is divided into three pillars. It's the financial, the operational, and the social sustainability. So, and as and successful biobanks have to address all three at the same time. It's not sufficient to be excellent in your work. You have to let people know that you exist and why this work is important to address the social side, but also to go to the policymakers and say, look, this is an investment, but there is a return on this investment. So the danger that we have with the project-driven biobanks is that we focus too much on the operational because this is a project and it has to deliver with specific timelines and deliverables, but we ignore the other two components that are actually equally as important. We find that again, there isn't a single solution, but biobanks that do better in terms of sustainability tend to be more pragmatic on what they collect. So they don't collect everything, they're very selective. They tend to be very prospective on their collections. And the more permissive on who can access the samples. So if people if it's in a university hospital, for example, then they open it up to other university hospitals. It doesn't necessarily have to be the private sector or pharma. It can be, but most of the research that biobank service at the moment are public health funded research initiatives. So if they can be able to connect with as many of these initiatives as possible, that's positive for their sustainability.
Yeah, that's actually very good. That's very good advice. When you say, not collect everything. I mean, that's a very key, a very important point because it will be very expensive to do. And most of the people that I know would want to collect everything, but that might be a problem. And then also permissive, I like that keyword as well, to share to others. That's the point of the biobanking. There's
Yes,
a
and
question. Yeah.
sorry to interrupt you, and I can understand that people have, you're a doctor in a hospital and this is your life's work and you've collected with a lot of effort and curated. But honestly, so what you can do individually is limited, and unless you open it up and collaborate, you don't have to open it completely. We have a guideline in Europe that says as open as possible, as closed as necessary. You find the red line where you want to go. And that's the best recipe for sustainability. Sorry, I did interrupt you there.
Yeah, no, excellent. You laid it out very well. There is a question here, but I think it's a little bit more directed to me, to the Philippines. Is there a lead agency or institution in the Philippines regarding biobanking where we can coordinate or get in touch? Honestly, I don't know if there is one in the Philippines, a specific agency. As far as I know, when it comes to biobanking, it's more project-based. So it depends on funded projects who are already doing collection for biobanking. In fact, some of these are more disease-based. So we have these well, not just a disease. So, for example, the newborn screening. So there's a lot of samples already being collected. So the intent is to find if there are anomalies, right, at birth, and that's one of the biggest biobank that I know of in the Philippines. When it comes to cancer, there are only a few projects here and there that are doing that. And COVID samples, there's a lot of COVID samples after the pandemic. So whether they're able to share that, that's another case. But I don't see anyone that has one, although we do have a national ethical guidelines in terms of biobanking. So you can refer to that. We call it NEGRIP for short, but it's National Ethical Guidelines. It's a handbook that contains the policies, or actually it's not really a policy, it's more of a guideline for biobanking. Let's see, are there any other questions from the audience? So looks like I don't see any other questions. But we actually have almost 100 people
Yes,
here
yes.
in the
There's clearly a
in the
lot of interest.
seminar. Yeah, and something that I would like to share as well. We're in a good situation right now when it comes to biobanking. The government, at least the Department of Science and Technology, one of our biggest funding agency, is very much interested of banking of a lot of different types of diseases. Now, especially now with the COVID, they understood
Yes.
that, oh, we have to be doing biosurveillance of other diseases, no? And then of course the sort of epidemic that nobody, the silent killer is the cancer, that's just lingering there, and cardiovascular diseases. So all of these things, that there are people are interested in doing biobanking. So there's funding here, but we want to capture this so that the government money doesn't go to waste, and that we can share the appropriate information or the appropriate samples, and then maybe find cure for diseases that may be rare in other countries, but very common here in the Philippines.
Yes, and our experience from Europe was that when the biobanking field started developing very rapidly about 15 years ago, when its national government wanted to support the National Genome Initiative, the funders were very sensitive to avoid the funding of identical activities. So you would have a biobank in the area, and then they would say, well, you have to provide evidence why you cannot use this biobank for your work instead of creating a new one. It's surprisingly how sensitive they were and how quickly. But I mean, it's actually good because they protected the public money in that way.
Yeah, that's excellent point. Actually, we are starting to hear that as well in the Philippines as well, from the UST saying the same thing. So yeah, this is a very exciting time, and we can learn so much from you because you said 15 years ago, and that's like Philippines now. So maybe we can see, oh, what's going to happen here, anticipate
So
what's going to
I
happen.
can see 3 questions. One is from an anonymous
Thank you.
attendee. Yes, in the Q&A. It says, is your agency open for research collaborations with tertiary education institutions? The answer is yes, but it depends on the question. So it would have to fit on the current priorities that we have from the member states. So I would say yes, but there is a big asterisk next to the yes. The second is from a medical student from Manila, the University of the Philippines, for building a biobanking facility from scratch. Well, I would say just access the minimum common technical standards that IARC has produced. It's got a lot of SOPs there and a lot of references. And it's a good guide for starting a biobank. There are some facilities that are that have published their work on how they started, and they can also be accessed online through a literature search. And there is another one for a guideline or framework by which metadata collection may be standardized for biobank samples. That's a very big question at the moment in Europe, because we're embarking on the European health data space, which is a common data space for healthcare. So we need to have the metadata to at least upload the metadata onto the system. There are 2 or 3 that are being used and they're interoperable. So there isn't a single best in class, let's say, but there are 2 or 3 good ones. I can give you an example. The Molgenis one is something that is very commonly used in academic biobanks.
Excellent. Looks like Dr. Plebian Medina is here. I
Yes, Ian.
believe,
Hey.
yeah, you guys are collaborating. And so he mentioned that RIT-MDOH is leading the biobank of pathogens and
Correct.
spearheaded the recently concluded ASEAN Biobank of high-risk pathogens.
Yes.
Excellent. So yeah, maybe later on we can have a follow-up emails to see how we can continue on, not just simply webinar, but we can maybe have an actual physical training or maybe even build some projects together. You can help us, train us on some things, and maybe with RITM, Dr. Medina, on certain projects together.
Correct. Absolutely. Yes. Yes. I think that's a very worthwhile discussion to be had.
Excellent. So with just the interest of time, it's already past 5 o'clock. I'm sure there's still a lot of questions and discussion ongoing, but we have limited time. We're supposed to end by 5. But this has been very good, very, very exciting, and I'm looking forward to more collaborations. And also, please stay tuned for our next seminars. A seminar and part of the seminar series. We will just send an announcement when that will be. On behalf of the Philippine Genome Center, we would like to give you a certificate of appreciation. So it's just online. It's a soft copy. Thank you for being the resource speaker for this presentation on the talking about international trends and standards in biobanking. We really learned a lot. I mean, at least I learned a lot from this activity. And so we hope that we can send you a copy of this, by the way, so that at least
Yes,
a souvenir, right? There's also a message from Dr. Saloma. This last item, did I forget something? See if I missed something. Sorry, that was an interruption. But at the end, by the way, at the end of the presentation for the participants, please make sure to fill up the evaluation form so that we know how we can improve some more in terms of our delivery. There's some, if there's technical difficulties and all that we miss. We apologize for that, but please do send in your feedback, as well as if you want to suggest speakers, and if you want to suggest a topic that we would like to talk about. Please, let's focus on biobank. So that's the idea for this series, and so please fill that up as well. So it's if you use QR code, it's here, it's flashed here, but there's also a link on the chat box. Also, at the end of this webinar, it will automatically direct you to a website. So there's some sort of techie thing going on afterwards that will direct you there. So with that, thank you so much, everyone. And I hope that you enjoy the seminar today. If you have questions, please feel free to send an email to us, the Philippine Genome Center, and feel free to if you have more questions, so feel free to contact us, so we can relay it to Dr. Zisis. Maybe you can email directly to Dr. Zisis. You can find his email on the IARC website. That's actually how I was able to find him. I was trying to research, and then was able to find him.
So I will send you a copy of the slides. So
excellent.
So whichever way they contact us, they can have a copy.
Okay. By the way, are you okay for us to share the video of this publicly, or do you want to limit the we usually post our seminar, but we
Ah,
always ask the speaker first if it's okay.
yeah, that's fine. I haven't mentioned anything that is not published. No, that's absolutely fine. I'm not sure that, yeah, not a problem. Yes.
Oh, excellent. Thank you so much. With that, thank you so much, everybody. And we hope to see you on our next seminar.